Good afternoon, folks. Now, I have discussion B for you. We are discussing intergenerational living for better senior care. Okay, here we go. Older adults are increasingly cared for at home because families are living together. More seniors are relocating to new regions. The 65 plus population is more diverse. Adult children are delaying independence, and technology enabled remote care is expanding. Each pattern reshaping who provides care, where it happens, and what services are needed. Key patterns changing. Home care. One, surge in multi-generational households. More families now include 3 or more generations under one roof, which shifts care from paid providers to family members and changes daily routines. Privacy needs and home modifications. Shared housing reduces cost, but raises caregiver burden. And privacy/safety trade-offs. Senior migration to new regions. Older adults are relocating toward lower cost, warmer states, disrupting community of medical care and local support networks. Portable, transferable care plans and telehealth become essential when seniors move. Rapid diversification of the 65 plus population. The 65 plus cohort is becoming more racially and ethnically diverse, increasing demand for culturally and linguistically appropriate in-home services and care navigation. One size fits all home care models are less effective. Delayed independence among younger adults. Adult children are staying in or returning to the parental home longer for economic or caregiving reasons, creating households where care responsibilities are shared but also more likely to cause caregiver burnouts and role conflict. Technology and remote care adoption. Telehealth, remote monitoring, and smart home tools are being integrated into multi-generational homes, establishing clinicians to support aging relatives at a distance while family members handle daily tasks. Tech expands reach, but requires digital literacy and equitable access. Practical implications for home care. Who provides care? More unpaid family caregivers. Paid aides must coordinate with household routines. Where care happens, care is increasingly home and community based rather than institutional. What services are needed? Home modifications, culturally uh, competent services, portable care plans, caregiver respite, and tech supports. Quick decision making guide. What to consider. Household composition. Who lives with who lives there full time. Care continuity. Are medical records and providers portable if relocation occurs? Cultural and language needs. Does the care plan match the older adult's background? Caregiver capacity. Is there risk of burnout? Is respite care available? Tech readiness. Is broadband devices and training available? Risks, trade offs, and migration. Caregiver burnout and financial strain. Mitigate with respite services, pay home aid, and community programs. Loss of continuity after migration. Keep up to date electronic records and identify local providers before moving. Digital divide and equity gaps. Provide training and subsidize devices for seniors and family caregivers. Home care is being reshaped by 5 generational living patterns. An aging population driving unprecedented demand for multi generational households, sharing care, senior migration, disrupting community continuity, delayed independence of younger adults, reshaping who is available to help, and uh, rapid tech adoption, redefining what care at home even means, while staffing shortages and payment pressures force agencies to reinvent themselves with technology and new care models. Quick guide. What to weigh first. household capacity, who can reliably provide daily care, and what respite options exist to prevent burnout. Care continuity, portable medical records, telehealth access, and local provider availability if the older adult relocates. Cultural and language fit, ensure services align with an older adult's background and communication needs. Technology readiness, broadband devices, remote monitoring tools, and training for telehealth. Workforce constraints, anticipate limited paid care availability, and plan for alternatives early. Guys, you have to think about these things when you set up care for family members, intergenerational folks. Language has to be considered, things of that nature. Evidence and operational drivers. Demand to grow demand growth is accelerating as more complex care shifts from hospitals to homes, and durable medical equipment becomes central to daily functioning. Staffing shortages remain the top consistent constraint, with many agencies reporting persistent difficulty recruiting aides and nurses. This pushes organizations toward automation, streamlined workflows, and upskilling. Payment reform is reshaping incentives, with value-based care models rewarding prevention, coordination, and measurable outcomes, making data documentation and remote monitoring indispensable. Risks, trade-offs, and mitigation. Caregiver burnout and financial strain. Unpaid family care fills gaps but increases emotional and economic pressure. Mitigate with respite programs, paid aids, and adult day services, and employer caregiver leave. Continuity gaps after mitigation. Moving seniors often loses established providers. Mitigate by transferring records early, identifying local clinicians in advance, and using telehealth to bridge gaps. Digital divide. Technology expands reach, but excludes those without broadband or digital skills. Mitigate with device subsidies, training, and low-tech alternatives for essential tasks. Workforce instability. Turnover disrupts care. Mitigate with consistent scheduling. Better pay structures and tech that reduces administrative burden. Practical next steps, household checklists, map roles, identify who can handle personal care, meds, transportation, and medical tasks. Plan continuity. Secure electronic records. List providers and prepare for relocation scenarios. Assess tech. Confirm broadband devices and training for telehealth and monitoring tools. Build respite, identified paid aids and community programs or short term stays. Clinical plan. Estimate paid care costs and ensure insurance insurance penalty uh, penalties and community support. Okay, guys, that's your B. I will be back on with C in a bit. For now, get a wellness. Take care, folks.